COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25. 30 days, 15 persons. Reduce the exposure of that infected person by 75%. In 5 days, you infect 0.625. In 30 days, 2.5 persons. Remember, the virus does not move on its own. People move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health. Persons at risk of becoming seriously ill from the flu or the coronavirus. People over the age of 60, persons with medical conditions they already had, such as diabetes or heart disease or conditions that has made their immune system low, such as HIV or cancers. At this time, there is no vaccine or treatment. Serious cases may need oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health. Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health. Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800-MOH-CARE or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health.
Border jumping is illegal and puts our entire nation at risk. Our neighbors, Guatemala and Mexico, are experiencing rapidly increasing numbers of COVID-19 cases, and there are more deaths every day. Persons entering Belize illegally from these hotspot countries are not being tested for COVID-19. That's why it is important to report anyone entering Belize illegally by calling our hotlines. Smart users call 0800-JUMPERS or 0800-BORDERS. For Digi, call 0800-SAVE-BZE. Condoning or engaging in border jumping is putting yourself, your family, and the entire country at risk. Remember, anyone caught will be fined up to $5,000 and or imprisoned for 2 years. Stop border jumping now. This message is brought to you by the Belize Police Department and the Belize Bank.
Saltar la frontera es ilegal y coloca a toda la nación en riesgo. Nuestros vecinos, Guatemala y México, han experimentado un rápido incremento de casos de contagio de COVID-19 y hay más muertes cada día. Personas entrando a Belice ilegalmente, viniendo de esos países con múltiples casos, no les están haciendo las pruebas de COVID-19. Es por eso que es importante reportar a cualquiera que entre ilegalmente a Belice llamando a nuestras líneas directas. Para Smart, marque 0800-586-7377, 0800-267-3377 y para Digi, marque 0800-728-3293. Tolerar o participar en entrar ilegalmente es ponerte a ti, a tu familia y a todo tu país en riesgo. Recuerda, cualquiera que sea arrestado deberá pagar una multa de hasta 5,000 y o prisión por 2 años. Detén el salto de fronteras hoy. Este mensaje es presentado por el Departamento de Policía de Belice y el Banco de Belice. El contrabando es importar ilegalmente productos como el alcohol, tabaco, comida y objetos. Aparte de romper la ley, los contrabandistas están poniendo ahora en riesgo la salud de los beliceños. Ellos arriesgan traer coronavirus a Belice por medio de sus contrabandos. Para mantener el COVID-19 fuera de Belice, todos los que entren al país son examinados y encuarentenados. Sin embargo, los contrabandistas no utilizan los puntos de entrada legal y se saltan todas las medidas de seguridad. Estos mismos traficantes se están moviendo entre la población. Ellos podrían tener el virus. Al entrar ilícitamente al país, esto puede provocar un brote de COVID-19. Comprar o traficar contrabando te pone a ti, a tu familia y a todo tu país en riesgo. Para números de Smart, llama al 0800-586-7377, 0800-267-3377 y para Digi 0800-728-3293 para reportar cualquier actividad de contrabando. Este mensaje es presentado por el Departamento de Policía de Belice y el Banco de Belice.
Contraband is the illegal importation of goods such as alcohol, tobacco, foods, and parts. Apart from breaking the law, smugglers are also now endangering the health of all Belizeans. They risk bringing coronavirus into Belize with their contraband. To keep COVID-19 out of Belize, everyone entering the country is screened and quarantined, but contraband smugglers are not using legal.
Okay, good afternoon. all. Just to provide a brief update in terms of where we are with our testing and other health-related matters on the topic of COVID-19 on the heels of a hurricane that wasn't fortunately that bad. Understanding it would have been much worse, but I believe that also put a note in terms of reviewing our hurricane preparedness plan within the municipal structure. And I think it tested what a hurricane preparedness plan would look like in terms of COVID-19, which is what there had been some preparation meetings with SEDIMA in the region, and other Caribbean countries would have looked at what it is that we intended to do with what was happening on the ground, particularly with the current trend that we have, the current numbers that we have in terms of COVID-19. So I'll give a brief rundown on those numbers, and then a couple of other notes we are working on as we advance our plan, as we head into what's the 9th month now of the year, when it seems that we have only been discussing COVID-19, but understanding that there are many other health-related topics that continue as we move along. So we had not done the full testing that we would have wanted on Wednesday for obvious reasons. The lab had to close earlier, so we didn't have the full complement of staff that is routinely doing shifts. By Tuesday of this week, we had pretty much caught up with all the backlog of samples from across the country. So we felt that through this weekend, we would have been basically turning around PCR results within 24 hours. However, well, that, as you know now, was delayed. But they still managed to process one batch of samples yesterday, which was published as part of the infographic, which we aim to now produce on a daily basis. So yesterday, a total of 91 samples were processed, with 17 new cases, most of them being in the Orange Walk district. 15 of those of the previously documented cases are now were recovered yesterday. You will now recall that 1 week ago we started defining a recovered case with one negative sample. We don't do two anymore. So once you have a negative sample, you are considered as a recovered case. And so we have approximately 24% of the total identified cases that we can classify as being recovered, with 850 plus cases still considered to be active. We have had in the infographic that you're going to see today, and it's going to come out in the next couple of hours. Hopefully, we have processed all of the results. By then, we have had 2 deaths in the last 24 hours. One is in a female who had been intubated for a week at Carl Huchner. That patient had been referred 1 week ago from San Pedro to Carl Huchner and had been intubated through the weekend because of respiratory failure. That patient passed away earlier today after being there for 1 week. The other case is that in a male from rural Belize district. He died shortly after arrival at Carl Huchner Memorial Hospital on Tuesday, September 1st. The person didn't seem to have, or wasn't reported that they had any respiratory symptom. The primary reason why he was being taken to the hospital was general weakness, general malaise, fatigue, with loss of appetite. He died shortly after arriving at Carl Huchner. The protocol is that we would have tested him with a gene export sample, which is what we use for cases that may have that are highly suspect and are in the containment area or the transition area at Carl Huchner, to determine quickly if they are a potential COVID-19 case. The initial gene export test had been negative, but protocol again calls that once it's negative, we do a PCR test on that person, and that result has come back positive for SARS-CoV-2. So while in the death certificate it's not going to list COVID-19 as a primary cause of death, we do call that as an associated. So it is placed somewhere in the death certificate. And mind you, we have had a couple of death certificates that have been done that we have had to go back and review to place that diagnosis in there. As is right now, we are, the epi team is actually reviewing, because you don't want to miss any other potential cases out there. So the epi team is reviewing any persons who are, if you are having a higher mortality rate when you compare it with other years, or if there's any unusual amount of cardiac related deaths or cardioembolic strokes, to see if there's any potential cases out there that the system may be missing. It doesn't seem to be that we have an unusual higher mortality than other years, but we're going to go back and review that particular data. In terms of the preliminary data for today, it's pending, of course, for it to be reviewed. 265 samples. It seems preliminary that it's 34 positive cases. And I say preliminary because the lab will only put it out as a positive case. it could very well be that once you go back to the data, you find out that the person has already been diagnosed and it's only a person that remains positive after a given amount of days. So that's why you always have to cross check to make sure that these are in point of fact new cases, and that is what sometimes causes the glitch that you see in the infographic that we have had to go back and review, because it's an automated process, but then you already in a different forum heard the people behind the infographic that come out and see how that process works in terms of contact tracing and all of that. We had also started the process of validation of a rapid test. We had mentioned that from a press conference that Prime Minister had called last week Friday, slated to have been run out in Belize and Orange Walk districts, but again, because of what the hurricane situation, you have to prepare for that. So basically, you're going to prioritize and start just dealing with more key aspects. So that process was stalled. It is being taken up again, and the process is that we will collect samples at the flu clinic in Belize City. So what you're doing is a field validation exercise for both rapid tests that we currently have, along with a PCR test. So that will be happening primarily in Belize City. The team will then be, we've already started the planning process for doing a further validation exercise on the field at a wider scale, primarily in San Pedro, in select communities in Orange Walk, rural Orange Walk, and we are thinking of taking it to bigger workplaces. We had indicated in different forums that you're aware of a poultry, the industry being affected in a community in Orange Walk, and then we had another industry being affected, and then Belize sugar industry also noting that 2 of their employees had tested positive. So we have considered going into these particular bigger workplaces where you have more employees that are potentially exposed and who are symptomatic, and run further validation exercises on the rapid tests. This morning when we met as a team, we also reviewed this issue that we seem to be having, that we have a good amount of persons that are still testing positive on the PCR test at day 14. I mean, in just San Pedro alone, the doctor yesterday communicated to me that he has more than 160 persons who have gone beyond day 14 and are still positive. Now, the data will tell you that persons are not routinely going to be symptomatic, which means they are not, that they are not really going to be passing on or shedding viruses or infecting others, but it's still positive on the PCR test. So that's something we're reviewing. When people are able to go back to work, even if your result has not come back as negative, but you are not having any sign or symptom, then that's a note that we are making for the employer. We are also being made aware that some persons, after they have converted, the result is negative, some persons are still having some level of respiratory distress. Some people are still referring back pain, weakness, general malaise, and this is part of what has been described in the literature as it can happen. I mean, it reminds me of dengue. When people have had hemorrhagic dengue, they can take 3 months to recover. With SARS-CoV-2, people have different signs and symptoms that can last for also extended periods, and it can be weeks and months, as has been described in the literature elsewhere. We are also aware of the mental health component that is coming along with SARS-CoV-2. We do note that people have mental breakdowns. We have had people showing up at facilities or making calls because they're just having panic attacks and other mental health conditions. Next week, we plan to be fully engaging with the media and using all our social media outlets to discuss the mental health component and SARS-CoV-2. Next week is also World Suicide Prevention Day, which usually, it's observed every September 10th. It's usually caught up with St. George's Key Day in Belize, and so it's not that visible, but we intend to highlight that particular component towards the beginning of next week and all throughout the week. Also, of the nutrition component, we intend to have, as the experts, both the nutritionist in English and the INCA person in Belize in Spanish to discuss that, because for the you will also know that traditionally every September we have a Caribbean Wellness Week trying to promote healthy lifestyles, well-being, as a means of trying to tackle chronic diseases. Belize had used that to push for that to be incorporated at the Central American level with Comesca, and so Comesca does Semana de la Salud, which will be next week in Central America. So we will have some items to discuss there. We should be releasing later on today a press release on cleaning agents and how you go about sanitizing office spaces, because it seems that we are getting calls or concerns where people are, after somebody tests positive in the office, what kind of cleansing or sanitization process needs to happen. It's nothing out of the extraordinary. The Ministry of Health has not really endorsed any of the agents that are promoting themselves out there. The principal public health inspector has, in a different forum, also highlighted what 3 key and core elements you need to do cleaning of any specific surface. It doesn't have to be anything specific or expensive, and it doesn't have to be any specific entity. Sanitizing can be done by persons who routinely do that in your office setting. In terms of available options, we did go back and review, and again we review the data on a daily basis. I know there's this push in some areas to discuss ivermectin. First, we did go back and review. We don't have anybody importing ivermectin for human use in Belize, at least not through any of the official sources. All the ivermectin we have found is exclusive for animal use, and I am making a specific note of that because we are aware of persons who have been procuring ivermectin and using it on humans, and that's not the indicated use, and we can run into more problems from the health standpoint than any potential benefit. The 2 studies that we saw are being discussed primarily in Australia. There are some studies that suggest that it may work. I had said last week, I believe, that ivermectin has been proven to work in vitro but not in vivo. And then there's one study highlighted in Egypt, but because we could not find it being published anywhere, and the sample size would not give it enough scientific relevance for us to consider it. And then even how it's made its use into the Bolivian and Peruvian guidelines remains a little bit sketchy from the scientific standpoint. In terms of, I know we stopped looking at the numbers around us because we got caught up with our own epidemic, but we cannot forget the fact that even though Chetumal specifically, or Otonpe Blanco, the municipality, seems to have kind of plateaued, cases are still there. They're still having active cases. They had a much higher mortality rate than we have had. But let's not forget that neighboring Honduras and Guatemala still have very much active numbers. Guatemala has 76,000 plus cases, and Honduras with 63,000 plus cases. In terms of testing, our testing rates, and again, this is testing rate, we're not talking about persons per 100,000. Testing rates in any world comparison talks about the number of tests administered per given population. So we are compared under the same variable. Then it still remains twice as many as what Mexico is reporting, and still higher numbers than Honduras, Guatemala, Trinidad and Tobago, Jamaica, Guyana, and Suriname. One final note before we get into the questions is the note of exposure of healthcare workers. Earlier in the week, I had highlighted the total number of persons, and you see it's people from different sectors. It's administration, lab personnel, pharmacy, physicians, nurses, healthcare workers who work in people who do the cleaning component. They are classified as long as you work in the health system. Um, I can indicate, and this is not casting blame on anybody, but I think it's just so that we can understand and appreciate that um, the vast amount of healthcare workers that have become infected has not been linked to the line of duty, but it's rather what we go about doing in our lives outside of the healthcare setting. And I'm not saying this to cast any blame on anybody, but I just so that we can understand and appreciate that we really cannot let our guard down. Not only healthcare workers, we out there in the community, if most of these are non-work related, then you can also understand and appreciate why SARS-CoV-2 is here to stay, and why we must remain cautious and on guard for any potential cases. In light of that, it does seem the preliminary notes we got is that our colleague, the epidemiologist from the Western Health region, is progressing along fairly well, and they would attempt to take sedation off through hopefully this weekend, and that's the first step as you aim to take somebody off a ventilation mechanism. And this is I mean, good news, and we always are on the lookout for any information that comes in light of that, because the longer you stay hooked up to a ventilator, then the prognosis can get worse. He is one of 2 confirmed cases that are currently intubated at Karl Huchner. I don't have any other note of any person being intubated at Karl Huchner now. So I guess I'll jump right into the questions, and then as we get any notes through, further notes with confirmation of those rapid or those tests that have come out positive, then we'll take it from there. So I'll get into the questions. I don't know if we're gonna be having many today. It says, can the Ministry of Health use other methods to treat COVID instead of using ventilators? It's a very valid question, and perhaps so that we can understand what's really happening is ventilators are not used to treat COVID-19. And I am saying this because I know there's some notion out there that in some areas is gaining some level of traction, where people are equating the use of a ventilator and what happens to persons making the comparison that half of our patients that have died have been ventilated, and suggesting or implying that that might be the reason why we have such a poor outcome. But a ventilation mechanism is done once the patient has respiratory failure and you are not going to be able to recover that person. I mean, once some patients are tired because they have had labored breathing, can't breathe no more, and so you put them on the sedation, hoping to improve your ventilation mechanism. Or if people are having, now again, SARS-CoV-2 is not done only for people who have respiratory failure. You can be ventilated if you have cardiac dysfunction until your cardiac situation has been improved. If you have sepsis, which is a generalized infection in your bloodstream, you may also be ventilated until you have improved, until antibiotics have done their job. So we're not using ventilators to specifically cure or as a treatment of SARS-CoV-2. So I think we need to get away from that notion. Again, the flip side to that would be what happens if the patient is not hooked up to a ventilator, and what is the outcome, and you already know what is the outcome in terms of that. So ventilators are not used to treat COVID-19. That's used whenever the patient has had multiple organ failure or is having severe respiration failure. How many cases are hospitalized? Well, I have mentioned that at Karl Huchner. They would have, I know they discharged 3 patients earlier today from their ICU, and they would still have, I believe, 3 more that are still on supplementary oxygen at Karl Huchner. Again, I know in Orange Walk they had 3 patients as well. They were on supplementary oxygen. Western region and San Ignacio didn't have any, and I know that up north we have had also patients who had surgery I mean, that's the reason why they went in. It's not because of SARS-CoV-2, but they had that added diagnosis. How long do you have to wait for results after being swabbed? Well, at the beginning of the week, we were already down to 24, 48 hours, provided your sample after it gets to the lab. Because, I mean, we had mentioned, if you get swabbed in Punta Gorda today, the time it takes to get to Belize City is might be longer than if you are swabbed in Belize City, where they can rush your sample to the lab. So it's contingent on that. But once it gets to the lab, that result should be out within 48 hours. So the average is still going to be around 72 hours. I think when you look at the lab data, you will see that a vast amount of persons are being processed now. Lab was getting almost 250 samples out every day. Can you please give numbers on the COVID deaths as to how many people had underlying conditions? Other countries are releasing this data. Belize can too. Yeah, we have been saying what other underlying conditions people have had. The 2 deaths today are 1 male and 1 female. The current evidence suggests that males are having a poorer outcome in terms of SARS-CoV-2, not only in Belize but in other jurisdictions. There's also a note to indicate that women seem to recover faster than do men, and it has to do with the evidence that's starting to come out in terms of the pathophysiology of SARS-CoV-2, some factors that have to do with the male-female situation. The underlying condition in Belize, one factor that seems to be kind of like a determining factor is having had previous heart conditions. Hypertension or heart disease and obesity seem to be the more predominant factors that we are noticing in people who are dying as a result of SARS-CoV-2. And it would seem that obesity would be perhaps the more prevalent. Now, this is something in a different forum, and people who have heard me talk about non-communicable diseases, I have been always saying that you could go to a doctor and your blood pressure is good, your sugar is good, your cholesterol is good, your triglycerides is good, and you feel like the king or the queen of the world. But if you're obese, you are sick and you should be classified as such, because obesity is not considered to be a condition. It's a medical condition, and it should be stressed in your medical report that obesity is such a factor. No specific treatment, if you will, but it needs to be classified as such. It says here, common recovered cases are there in the island of San Pedro. I don't have the exact figure, but I do know that up to yesterday we had 163 active cases, I believe, with a good amount of those being beyond the 14 days. Are all recovered cases so designated with negative tests for the time being? Yes. So when you see that infographic, everybody that's in that green column there is because they have had initially, up to last week Friday, two negative tests, 2 PCR tests that were negative, but now it is one test that's negative that will classify you as being a negative case. So you're not in that infographic until you have one negative result. Can folks be clinically diagnosed for COVID and after quarantine also clinically diagnosed as negative without taking a test? Not right now. We have discussed that eventually we may have to go down that like other countries are doing. But for now, the only way you will be classified as a negative case is once you have a negative PCR test. That criteria has not changed, but we have discussed that in other countries you do have persons who are sent home or who are classified as recovered without having gone through any negative test. So that means that after 14 days, if they are not having any sign or symptom, they are classified as a negative case. Can you discuss where the case in San Antonio, Toledo originated? I believe they are linked to cases around the Belmopan area, and specifically the last note I recall is to Armenia. So that's where it would be. We had said that eventually, if you try to track down all your cases, you can find a link somewhere. So that's where those cases would have been, and there are little clusters which are family clusters that we have been able to identify. So if you're ventilated for COVID-19, that means you don't have any chance of in coming out from there alive. Not really, but again, ventilation becomes your last resort. If you are not ventilated in due time or whenever, you see, the ventilation mechanism is a planned process unless somebody crashes. That's how we would say in epic terms. That means you do respiratory arrest, which means you stop breathing, or your heart stops, which is cardiac arrest. If any of those two happen, you don't have any other option than to try to intubate somebody and push oxygen in somebody's lungs and try to reanimate with medication. But in cases such as SARS-CoV-2, when you see the patient is progressing gradually, is getting tired, the breathing is labored and it's not improving, you connect them, you do what's called a planned intubation, which means you sedate the person before you do the intubation. So you use that as your last resort. If you don't do that, then the more than likely is the person will have a cardiac or respiratory arrest. So you want to avoid that. So placing you on a ventilator eventually becomes the ultimate situation that you are trying to use on somebody. So I rather than thinking of it that it's any chance of not coming out alive, is because that becomes your lifeline. That's being given to you in the hopes that that's the only thing that will keep you alive, and you can eventually be taken off a ventilator, weaned off a ventilator. As I said, it's not only done for that. I mean, recall before SARS-CoV-2, Carl Houston has 6-7 ventilators in their ICU that are used for people that required ventilation support. The other situation there is that we have had other persons that are currently intubated elsewhere in the hospital. It's not only SARS-CoV-2 that are being done. But of course, if you only want to look at people who are intubated and say, okay, everybody or the persons who are in an ICU and are intubated, your mortality rate is high. Well, when you look at mortality rates in intensive care units, of course, they are going to be much higher than when you're in internal medicine ward, in gynae ward, or surgical ward. Meaning ICU, you have critical patients, right? And so we have had other patients in other areas of the ICU that have gone in and have come out as well. Has any COVID patient been successfully extubated? Not for our context. As I said, the 2 persons that we have, hopefully that there's been going to be an attempt at taking off sedation, and hopefully that can happen through the weekend. Can you comment on reports of 2 deaths today, Biscayne and San Pedro? I already said who the persons are. What the cases were about. Why does Belize has far more tests done and Orangewac has 4 more positive cases? Remember that what the infographic does is it captures persons where you were swabbed. So in Belize, the one of the primary reasons that contributes to their higher number is all the repatriated flights. All the flights that have arrived from the beginning of when we started doing repatriation, which is 3 months now, those are all going to be classified under Belize City. Under the same token, any positive case from the repatriated flight gets captured as if they were in Belize City, when in point of fact they could very well have been from Orangewac, Corozal, Cayo, or anywhere else. When someone has tested positive, why do you all test them on their 2 weeks being sick? The virus is still in them and their test result likely will be positive again even if they don't have any symptoms. Why not test them at the end of the 3rd week of being sick with COVID? Well, the guidelines anywhere talk about your swab being at day 14. If If you recall, this has been from published data from the beginning of the year. And if you are negative, you should be resubbed again at day 15. But we're only doing one. If you're still positive at day 14, then we're more than likely going to swab again until day 21. Will there be a change to the mandatory quarantine for repats policy as the PM discussed? Yes, there was supposed to have been a repatriation flight today. We had mechanisms set in place which kind of were stalled on Wednesday. That flight will now arrive on Monday, and so next week we are supposed to have Monday and Friday flights. What we are doing is we are not testing people upon arrival. We are swabbing you at day 7. So the team is just looking at swabbing at either day 5 or 7 and releasing persons after they have been swabbed. Understand that the team have discussed this morning also that after the following repatriation flight would be after this Friday. The following Friday is going to be the 18th, and then the 25th of September, and then the week after that is when the airport is slated to open. So we probably will have to do the repatriation flight on September 18th and 25th. You have to do similar situations as when the airport opens. So those repatriation processes will be something more similar to what we intend to do once the airport opens. But for next week's flights, Monday and Friday, is people will have levels of staying in the hotel for 5 to 7 days before they are released. Doesn't make sense to force people to pay for quarantine when we have 850 active cases who are being trusted to self-isolate at home, which is why it has been changing. If you recall, 3 weeks ago we changed it to 10 days, and then it went down to 7 days in terms of how many days people stay inside a hotel. The other situation is people actually left. The ones who arrived on Friday were swabbed on Wednesday, and most of them were released on Wednesday, and that's simply because of the Hurricane Nana that was on its way. So people would have been released to continue their home quarantine home, and those results are just being processed now. That's when will Belize's epic curve peak? It's a very good question. I am assuming you're talking about the current wave, if you will, wave 2. The situation in San Pedro has, I think that has peaked, and probably peaked 3 weeks ago. We are starting to have the recovery of cases, so that's on its way down. In some communities in Orange Walk, it has started to come down as well, or has plateaued. It's starting to come down. But we may be able to do it by community and say where it's going to peak, but then the numbers are still going to remain fairly stable for the next couple of weeks, we assume, because of the numbers and clusters happening in other communities outside of Orange Walk district. So that's where it's kind of difficult to say when it will actually peak for Belize. I'm getting notes here in terms of people asking. We'll see if I can give you further details in terms of the geographic breakdowns. We had initially said that we were going to only be giving an infographic with active cases every Monday, and simply because it's not that easy to, it can be done, but it delays other processes that the epi unit has, and we don't have a huge amount of staff, and people wanting to know in real time almost where the positive cases are coming from. And so what we routinely do is, for example, the cases I just reported, we should be able to report at least district where they are coming from, and 24 hours later go back and verify from which exact community, because as I said, we have some people that are swabbed in, let's say, Belmopan, but they work in Belize City and live in Dangriga. So that's why sometimes you actually see more active cases, and I think an infographic has gone out like that in a given district than the number of confirmed cases they have reported. The confirmed cases is where people have been swabbed, and that's what makes it a little bit tricky for us to be able to pinpoint the exact location in the infographic. People seem to be concerned about why a specific area. I know the question here is speak about the case in Placencia district on dashboard. Well, that's where the person lives or is listed as living. I don't know that we should be giving any particulars. People still want to know names from the different communities. I don't know that it makes a difference to really be talking about names or the exact addresses where people are. And I'm saying this again, going back to the same community in which I live, which I think now has 10 or 11 cases. And just so that you know, I have lost track of how many cases there are. And for all intents and purposes, you have to assume that you have a positive case in your community. There's another thing that beyond the infographic that we publish, there's a dashboard where people can go and find a little bit more details than, and it's kind of like a live dashboard platform where people can go back and check the geographic location of communities, and we're trying to make it as interactive as possible. So that's and part of what the EPI team along with the GIS technician does to try to get those numbers to you in real time. So that's also a platform, and I believe that's up in the social media web pages. It should appear as a link in this forum where people can click on it and go back and review where the active cases are in almost real time. There's a little bit of a delay, but again, that delay is because of the verification process. So usually it's going to be a 24-hour delay in terms of getting that to you. I don't know. I think those are all the questions that we have. In terms of the other tests that we have been asked in different forums about the Abbott test, because you will hear that appear on the media, which is a 15-minute test that people can use. Of course, once it seems to have very good sensitivity and specificity. We are monitoring that. I don't know how much access we're going to have in Belize for the use, because I know bigger countries are going to have easier access to it, or quicker access to it than we perhaps are going to do that in Belize. And then we also have the note on the saliva test that has been launched by one of the companies, also in the US, also being on the lookout for it, because we're trying to make everybody's job easier, if you will, and we're trying to make sure that we are keeping up with what's being published elsewhere. In terms of the vaccine trials, I know that neighboring Mexico has received, and you will see this on the news, I believe it's 2,000 doses of the Russian Sputnik 5 vaccine, but understand that these are for a phase 3 trial, because some people have asked whether we will have access to those. That's still part of a trial. It's not being used in the population. You need to have a control arm, if you will. So that's why you will see some countries that are getting that. It's because they are part of a clinical trial still that are being done. In terms of how we're managing with private institutions can do swabs for us for the health system, and those are sent to the central medical lab in order to do PCR testing, and the results are provided back to the relevant entity so they can discuss the results with their patient. I think that's what we have for the most part, at least from my vantage point today. Next week, as I said, we'll be discussing primarily the nutrition element, the mental health component. For now, it's the measures that are now starting to appear, primarily, as I have said, is through breathing and talking. That it seems to be the primary mode of transmission, even by what is on a surface, and that's the evidence that is starting to come out. So I think it speaks to the relevance of wearing a mask properly to cover your nose and your mouth. Again, highlighting the fact that a face shield does not replace a mask. And if you want to wear it as a protection for your eyes, then it's the face shield and the face mask. But the face mask also has to deal with covering your nose and your mouth in terms of trying to not expel particles either when you're breathing or through your mouth. And that's not, again, I know that there's some we are getting on with traction with people saying that masks are control mechanisms and those kinds of things. I mean, we have no need for doing that. Trust me. I mean, we have our hands full with with things beyond SARS-CoV-2. So I think it's important that we highlight that situation. I don't have by previous infographics. I'm just gonna go and read the exact numbers as I'm getting it now. I guess this is going to be the final one, but 130 confirmed cases for Corozal. I guess you can go back and read the previous map because it's gonna come up as soon as I leave here. 393 confirmed cases for the Oranjewak district, 119 for the Cayo district, 37 for Stan Creek, 7 for Toledo, 207 for the Belize district, not including San Pedro, and Ambergris Cree with 259 confirmed cases. 15 deaths now, 9 males, 6 females, 271 total recovered cases, and the total number of confirmed cases that we now have is 1,152. So that's what we have. Thank you very much for listening to us. Thank you for all the support you continue to give our health staff, who is really, I mean, I know it's Friday for some persons, but in terms of the health system, that work really continues. I know the lab will still go through the weekend and continue to process samples. People across the different hospital settings that didn't really go anywhere but to work, and for those particularly down south that went beyond the call of duty to attend to all the calls that came in with persons requesting health assistance, and who had to be, health staff had to be deployed to go and look for them at their homes and stuff. I think we need to be appreciative of those situations. And as we move along, I know that we are now in the September month of what would be routine celebrations for September. I think we will have to learn on the new norms, that it's not going to be the traditional September celebrations. And I think the best way of showing our civic pride and patriotism is by listening and abiding by all the prevention measures, because we really do need it now. Thank you very much.